It's the distance we've been told to keep from each other, 1.5 metres, our own personal safety zone.
Wherever possible, keeping 1.5 metres between yourself and others.
This will not protect people from being infected.
Some studies have shown that when people sneeze, droplets containing the virus can be propelled up to 8 metres. Even a cough can take them 6 metres. They can then land on you, or they can land on surfaces that you then touch.
And largely, again, get infected through touching a mucous membrane, either putting their hand in their mouth, picking their nose, or rubbing their hand in their eyes.
But what is really concerning some scientists now is the potential for airborne spread. That person you saw sneezing, they've expelled both large and small droplets. Larger ones are likely to drop and dissipate quickly, but the smaller ones, called aerosols, do not. Aerosols, droplets less than 1/10 the thickness of a human hair, can be suspended for minutes or hours, and floating inside is the virus.
And in an indoor setting, these then, kind of hover around in an aerosol cloud. They don't easily disperse.
If true, large buildings could be highly vulnerable to fast spreading of the virus. Aerosols even have the potential to infiltrate ventilation systems, travelling from floor to floor.
During the SARS-1 epidemic in 2003, it spread from one infected person in an apartment block to multiple floors on that apartment block.
Many experts say this fear is being overblown.
The overwhelming body of evidence suggests that the primary mode of COVID-19 getting from one person to another is larger droplets. And if evidence emerges that this is more of a problem than we suspect, we will naturally change our position.
But others worry what airborne transmission means for people in the Melbourne towers.
There are operators of this building who can immediately trace the possible directions of the transmission. And this is what the individuals in these towers should do.
So far, there have been no confirmed cases of coronavirus infection via aerosols. But after hundreds of scientists wrote to the World Health Organization demanding they revisit the evidence, they are now reviewing their guidance. Michael Slezak, ABC News.